The next question, the member for Scarborough-Guildwood.
Thank you, Speaker. Throughout this pandemic, my community of Scarborough-Guildwood has been a hotspot for COVID-19. And my question is to the Minister of Education. This government lack of proactive planning has put people at great risk. I co-hosted an education town hall last week, and one of my constituents, Dave, shared the story of his daughter's class sizes increasing despite the fact that they're supposed to be safely distancing. And the reason given was budget restraints. This despite the FAO reporting today that the education sector has actually unspent $2 billion. You are not taking the steps to make sure that there is safety in our schools. Why are classes getting larger? Why is there no rapid testing in schools from the start of the school year? This government's pattern of delay has been costly for all of us. And your constant flip-flopping on rapid testing does not provide clarity to parents. So, Speaker, will there be enough rapid tests for every student in Scarborough? And how much longer do parents like Dave have to wait?
I remind members to make their comments through the chair. The Minister of Education to respond.
Thank you very much, Mr. Speaker. Mr. Speaker, I want to quote the Chief Medical Officer of Health, who I think the member opposite, I would agree, is an authority on school safety and on transmission in Ontario. He said, and I quote, "I hope the parents can understand that our schools are remaining safe. We've got excellent protocols in place, and the addition of testing strategy, asymptomatic testing strategy, will only further build confidence and support our school system. If you compare us to any other province, we're keeping our schools open, we're keeping our schools safe, we're minimizing the disruption in schools, and we will build an asymptomatic testing strategy for test and stay and surveillance. Our risk of infection remains relatively low in Ontario as compared to other jurisdictions in North America, and that's because our system is working," end quote. Mr. Speaker, we put in a layered approach that is aligns with the best medical expertise of the Ontario Science Table, who opposes a province-wide broad-based asymptomatic testing program, but supports a targeted approach, which is exactly what the government has adopted as another tool in the toolbox to keep schools safe, to keep them open, and to keep our kids learning. Thank you, Speaker.
The supplementary question.
Speaker, back to the minister. Why is this minister ignoring the fact that a third of all COVID cases are in schools? Speaker, we know that vaccines are the best way to beat COVID-19. Yet this government refuses to mandate COVID vaccines for in-person learning and is still willing to pack more than 30 students in a classroom. Over 25% of eligible students are yet to receive their second dose, and we know that children between the ages of 5 and 11 will soon be able to receive their vaccine. However, like many places in this province and in my riding of Scarborough-Guildwood, we have many parents who must work multiple jobs at extensive hours and cannot take their young ones to get their jab. So, Speaker, my question to this minister and this government, will you provide a plan and funding to schools so that those children 5 to 11 can get a coordinated way to receive their vaccines, or will you delay and keep them waiting again?
Minister of Education.
Well, thank you, Speaker. I think when it comes to the immunization of citizens, we should not politicize this. We should celebrate, as parliamentarians, the fact that this province has one of the highest rates of immunization in this country, one of the highest rates of immunization for young people in Canada, and yet juxtaposed against one of the lowest case rates in Canada. We're proud of that. We should all be proud of that. That has been because in part of the leadership of our medical frontline staff, our teachers, I think parents and students who are leading by example. Speaker, we have put in place $386 million, $383 million for the second year in a row to ensure class sizes can be to ensure distancing within our classes, to ensure that our schools are safe. But in addition to that funding allocation, we have stepped up the air ventilation, an additional $600 million, over 2,000 projects, 70,000 HEPA units within every school in Ontario, including in every kindergarten class and in the schools within our respective communities that regrettably do not have mechanical ventilation. While we are fixing that, we have put a HEPA unit in every single learning space, every gym, every classroom, every library, every tech lab. We're doing that because the Ontario Science Table leading pediatric experts have said that is the way to keep our schools safe. That is exactly what we're doing in consultation with the Deputy Premier to ensure students are safe, schools are open, and kids continue to learn.